website, who are live streaming on Zoom, or watching through the Verizon and Comcast cable channels. Before I get started, I'd like to get some reminders for folks. For participants, please be mindful to put yourself on mute if you are not speaking. And for citizens with questions, if you have already submitted a question in advance, you can do so through, we'll try to get to your question. And if you have submitted through, if you haven't submitted a question yet, you can do so through the Zoom chat feature. Lastly, I'd like to recognize some special guests who are here with us today, starting with my city council colleague members. So we have council member Ingrid Harrison on the line. We have council member Michael Estev, council member Dufour Wolfley, council member Roxy and Debbie Madu, council member Henri Gardner, and our mayor, who you'll hear from shortly. Additionally, we have school board member Rahila Ahmed, Senator Douglas Peter, Chair Todd Turner of the Prince George's County Council, our Congressman Steny Hoyer, as well as the delegates from the 23rd team, which include Delegate Geraldine Valentino Smith, Delegate Marvin Holmes, and Delegate Ron Watson. So our goal today is to try to get to your questions as citizens of Bowie. We'll take about 20 minutes for this briefing so you can hear how each local government is handling a response to COVID-19. And then we will head into question and answers that you guys have submitted or submitted through the chat feature. With that being said, I am going to pivot onto the briefings. I'm not sure if the mayor's on yet, but we can start with school board member Rahila Ahmed.
Sounds great. Thank you so much, Mr. Boalfo. Good evening, everyone. For those of you that don't know me, my name is Rahila Ahmed, and I'm your elected representative on the Prince George's County Board of Education. Over the past few weeks, there's been a whole lot of safety concerns about COVID-19.
Sorry, we're having feedback.
Oh no! Hold on. Just give me one moment. Is this better now, Ms. Cooper?
Yes, it is.
Okay, sounds good. Sorry about that, y'all. Tonight, I'll be speaking on 3 topics that I think are most important to know about in regards to the school district: continuity of learning, student meals, and internet access. In terms of continuity of learning, essentially every school district in the state has had to develop what's called a continuity of learning plan to ensure that students are receiving educational services while we're physically outside of the building. And it was really important for us as school leaders to make sure teachers felt somewhat comfortable with online learning, and students also had access to technology to engage with their teachers. So in our PGCPS plan, last week was designated for professional development for staff members on distance learning, as well as Chromebook distribution to students that were in need of technology. So for folks in the community, if you saw more folks parked outside of schools at the end of last week, that was why. It was Chromebook distribution. Per this plan, this week is spring break, and next week on April 14th, quarter 4 and online instruction will begin. If you want further details and more information about the continuity of learning plan, that's available online at www.pgcps.org/coronavirus. I'd also recommend signing up for eBlast from the school district. We've been communicating a lot through that. The second item that I want to talk to you all about is student meals. We've been really adamant about providing school meals to our students across the district since our physical buildings have been closed. In Bowie, Benjamin Tasker Middle School has been a primary site for that. And usually student meal pickups have been happening every day, but starting this week, students can pick up a week's worth of grab and go meals in fewer visits. So the meal pickups will occur twice a week between 10 a.m. and 1 p.m. Students can get meals for 2 days on Monday and 3 days on Wednesday, noting that there will be no meal service on Monday, April 13th due to spring break, but that'll resume the next day. And parents may pick up meals for students who are unable to come to the site by showing a student ID or report card, while students are not required to show ID if they come to pick up meals. So that's a little bit about student meals. The last thing I wanted to talk about very briefly is internet access. At our Board of Education meeting a few weeks ago, I voted alongside my colleague to commit $2 million worth of operating funds to cover the cost of internet access for families in need. So the school district is working with Comcast and Verizon to assist families of students eligible for free and reduced meals in signing up for Comcast Internet Essentials program, which provides affordable high-speed internet at home. Additionally, Wi-Fi will be opened up at several schools effective Tuesday, April 14th for anyone with a PGCPS email account to log on from the school parking lot or within close proximity to the school. In Bowie, Tall Oaks High School and Bowie High School are on that prospective list. So those are the three things I wanted to talk about: internet access, student meals, and continuity of learning. With that, I'll end by saying thank you to the City of Bowie for bringing us all together like this, and request for everyone on this call to please practice safe living for the coming days. You know, we're in tough times and folks all around us are hurting. So please check in on one another, be kind, be healthy, and be well. Mr. Boafo, back to you.
Thank you, Rahila. I appreciate it. And we all appreciate the work that the school board and our county is doing in response to COVID-19. With that being said, I'll pivot now to Mayor Adams, as I see he just got online. Mr. Mayor, are you there?
Can you hear me now?
Yes, you're perfect, sir.
Okay, thank you. Again, my apologies, few technical difficulties on my end. But first and foremost, I'd like to take a step back and say thank you to everyone for joining us this evening. I'd like to give a special thank you to Mayor Pro Tem Boafo, as well as the city staff, for organizing this so that we as a community can hear what's going on and get an understanding of the services that are there for us. I won't take very long, and I'll make this very short, because I know we want to hear from those who are on the line today to give us insights on moving forward. But I would like for us to make sure we take a moment and pause and thank all the city employees and staff for all they're doing to keep the city going, as well as the first responders and our medical personnel, but also for the people who are out there every day when we talk about public works and when we talk about those in the grocery stores and those just trying to keep us all moving forward, that we make sure that we pause for a moment and simply say thank you. And again, that we keep safe. And I'll turn it back over to you, Mayor Pro Tem.
Thank you so much, Mr. Mayor. With that, we will head to State Senator Peters in the District 23 team.
Thank you, Mayor Pro Tem, Mr. Mayor, and the council for hosting this virtual town hall. Tonight, I'm actually speaking for myself and 3 delegates who are all in the 23rd team. Each of them are working on specific COVID-19 issues. Delegate Marvin Holmes is working on electronic notaries. Delegate Valentino Smith is working on the food bank and social safety net benefits. And Delegate Ron Watson has been working on debt forbearance issues. So normally we go into session from January 8th to April 6th, but this year we were cut short by 19 days. We finished on March 18th, and that is the first time that's happened since the Civil War. Obviously, it was because of COVID-19, but we did get past a balanced budget. In that budget, we have $50 million supplemental for the Department of Health, and we put forth an unemployment insurance bill that is on the governor's desk to be signed. So let me just kind of explain how this is all unfolding. The governor is in charge, he's making decisions, and we gave him access to $1.3 billion through the rainy day fund. All he has to do is declare an emergency, and he did that on March 5th. So to date, he spent about $300 million of those dollars. And when he does, you see all these programs rolling out. When he does his announcements, he'll give some money to the Department of Health, which has been doing testing and education, the Department of Labor, which is doing unemployment relief, the Department of Commerce, which is doing small business relief. So he's taking that money and he's spreading it out based on where he thinks the priorities are. In addition, income taxes have been deferred to July 15th, and businesses submitting sales tax has been deferred until June 1st. So that total deferment is about $1 billion of delayed revenue to the state, obviously to help people who are having cash flow issues. So this is just a 30,000-foot shot of what's happening, and it's a snapshot. And I encourage you to go to different websites because they're updating those websites on a daily basis. I have a website, senatorpeters.com. There's a tab for COVID-19. I've got a number of the websites there that I think may be of interest to you, but anybody else getting on the line or answering questions, I think it's great to have them direct to the website because that's going to give you the most up-to-date information. Finally, I just want to say that in the midst of all this, we have the census, which is extremely important for funding our schools. So I'd ask you to take 10 minutes to fill out the census. You can do it online, do it through the mail, you can call in, but we really need to get our count accurate because that would cost us money if we're undercounted. So again, thank you, Mayor, Bowie City Council for hosting this, and everyone be safe.
Thank you so much, Senator. We really appreciate the work that you and the 23rd team are doing in Annapolis for the city of Bowie and for Prince George's County. With that being said, we'll move on to Todd Turner, who's our beloved chair of the County Council and represents District 4.
Thank you very much, Mr. Mayor Pro Tem. I'm not sure if I'm beloved, but I appreciate that anyway. First and foremost, I want to thank the mayor, obviously, and the city council, as well as the city staff for putting on this virtual town hall meeting this evening. I hope that we will be able to provide useful information to the residents and businesses in Bowie, as well as in the surrounding areas who are participating. My council colleagues and I share your deep concern about the impact, obviously, of the coronavirus pandemic, also known as COVID-19, on the health and safety of all Prince Georgians. COVID-19 has changed the way we live, the way we work, and the way we deal with each other. But together, working with you, we can move both the city and the county forward. We're continuing to work closely with County Executive Angela Alsobrooks, her executive team, the County Health Department, as well as the Office of Emergency Management, as well as our federal, state, private, and nonprofit partners to address services, information, and any necessary resources to our county in response to this health emergency since the state of emergency for Prince George's County was announced back on March 16th. As of today, Prince George's County has over 1,020 confirmed COVID-19 cases with 26 deaths. Unfortunately, that is leading the state of Maryland. The county opened the state's first drive-through testing site at FedEx Field last week and is serving up to 100 persons per day, 3 times a week on Monday, Wednesdays, and Fridays. But these are by appointment only by calling the Health Department Coronavirus Hotline, which is 301-883-6627. And we'll be providing information on what I'm talking about this evening to the city as follow-up to those who are participating this evening. So here are some additional resources that I hope are useful from the county in response to the COVID-19 pandemic, both here in the county and in Bowie. I do want to announce, I know County Executive Angela Alsobrooks will be hosting a teletown hall this coming Thursday, April 9th at 7:30 p.m. to update you on the county government's response to COVID-19. If you would like to join the call, you can register by calling 311. And the call-in number is not required to gain access, but you do have to register by 12 o'clock tomorrow, Wednesday, April 8th, if you want to participate in that countywide town hall, similar to the one that we have this evening. In addition, the county has its own information available on COVID-19. For the latest updates in Prince George's County, you can visit the Health Department's dedicated webpage, which is www.health.mypgc.us/coronavirus. Or again, you can call the Health Department's coronavirus hotline at 301-883-6627. Also available, this information is also available and links are available on the County Council's website, which is www.pgccouncil.us. Just last week, the county executive and the county council announced several programs and approved several programs to provide assistance to county-based businesses and not-for-profits. So let me go through those quickly. The first one is what we're calling the Prince George's County COVID Business Relief Fund. This is a $15 million fund established to provide financial assistance to businesses affected, obviously, by the COVID-19 crisis. This relief fund can be used to support cash operating expenses, including payroll, suppliers, rent, fixed debt payments, and other business critical cash operating costs. These applications will be available starting next Monday, April 13th, and will run through May 15th, 2020. This is jointly being done by the Prince George's County Economic Development Corporation, as well as the Financial Services Corporation, which is called FSC First. To get additional information, you can go to the www.pgcedc.com/COVID-19 for additional requirements for that program. The second one was announced last week is the Prince George's County Hourly Employee Relief Fund. This is available to residents who have been laid off due to COVID-19 pandemic, and they're eligible up to a $200 Employ Prince George's Visa cash card. Priority right now is being given to Prince George's County residents who are earning $19 or less per hour prior to their layoff. And these applications are available on www.employprincegeorgesedge.com. Again, we will forward this information to everyone, so the city of Bowie will have that. The last program I will talk about is the Greater Washington Community Foundation COVID-19 Emergency Response Fund for not-for-profits in the county. Through a generous donation of over $900,000, I wish it was 900 million, 900,000 by Sam Brin, who is a former resident of Prince George's County, provided this fund. And this fund will support 19 local not-for-profit organizations that have been already designated, and they will receive over $550,000 directly. The Prince George's County Public Schools is receiving $100,000, and that's particularly for the internet access that school board member Ahmad had talked about earlier. And the United Way of the National Capital Area will receive $250,000 to support small businesses in the county, assisting with coordination of food relief efforts. For information about the Community Foundation's COVID Emergency Response Fund, you can visit them at www.communityfoundation.org/COVID-19. Lastly, my office, as well as the entire county council and staff, while we are working remotely, are available to assist you as residents of Bowie and the surrounding areas. So you can please contact my office at 301-952-3094, or you can email us at district4@co.pg.md.us, or you can follow me on Facebook, which is at Councilman Todd Turner, as we're providing updates hourly, to be honest with you. So I'm hopeful that this information and on resources will help you navigate the impact of this pandemic. The County Council will continue to monitor the rapidly evolving crisis and assess any needs for additional information and changes and resources as necessary. And then in conclusion, I know we are extremely proud of how Prince Georgians and Bowieites are coming together to address this health emergency. We ask for your continued prayers for those directly impacted by the crisis and for our world, the United States, our great state of Maryland, and our own Prince George's and Bowie as we continue to fight this pandemic. With that, I will turn it back over to Mayor Pro Tem Boffo. Thank you.
Thanks so much, Todd. Last but not least, in Bowie, we are fortunate to have two great members of Congress who represent our area. One in Congressman Brown and the other in Congressman Steny Hoyer, who are both working day in and day out to ensure that the federal response on the health side is adequate and that we're finding solutions to combat this virus as a nation. So with that being said, our Congressman Steny Hoyer. Mr. Hoyer, you may be on mute.
Thank you. Can you hear me now?
Yep, you're good.
Okay. Thank you, Adrian, for that introduction. I am so proud to represent Bowie and Prince George's County, along with my dear friend Anthony Brown, who's working so hard and so well. To members of the council and the Bowie Council, thank you for all the efforts that you make. You're on the front lines in the community and critically important. And I think this panel, Adrian, shows it takes a village. It takes all of us working together. We have Rahita with the school board and Doug Peters with the Senate. And we just heard from Chair Todd Turner of the council of the county. And Angela, as was said, is going to have a town meeting this Thursday. We are all working together. For everybody on the call, I don't think any of us who have been here for some period of time have experienced anything like this event. And for those of you who are really young, I hope you never do again experience such an event. Essentially, America's economy has been shut down, and a lot of people are hurting as a result of that. In addition, of course, we have an extraordinary health crisis that we're dealing with. So I want to thank all of you for participating. I want to thank our state and county and municipal officials for doing everything they can to help those citizens, either from an economic standpoint or a health standpoint, are facing this challenge. So I also want to thank our frontline healthcare workers. It's right that people are clapping and thanking them and cheering them on. What courage they are showing. Our first responders, our police and fire and emergency response teams. Our truck drivers who are getting goods from here to there and getting food to the grocery stores, and our grocery store workers who are stocking the shelves, checking us out, giving us advice. And I want to thank all of us, all of you and us, because I'm doing the same thing, staying home and working from your homes or doing whatever you can from your homes to make sure that we do not spread this virus, which goes from people to people, and that we try to, as all of us have heard, flatten the curve. As this crisis continues, I'll keep advocating for assistance and resources for Prince George's County and the 5th District, and Bowie, obviously, as well. Congress, as you probably know, has passed 3 pieces of major legislation in response to the coronavirus crisis. We passed an initial emergency bill on healthcare, which was about $8 billion for essentially development of pharmaceuticals and therapeutics, as well as vaccines, and giving assistance to other health needs that we confront as a result of the coronavirus. Then we passed a second bill, which was larger and dealt with both the health consequences and challenges and the economic consequences. And lastly, a very large bill we passed on the 27th of March, just a few days ago, to provide very, very significant relief for our small businesses, for people who have lost jobs, for our families, for our children. You heard the school board member, Rahita, mentioned about nutrition and making sure children have a meal every day, which they usually got at school in many instances. Now, Maryland has already received over $17 million from this legislation and will receive much more. The second bill that I talked about funds research into a vaccine and treatment, as well as ensuring that Americans do not have to pay out of pocket. It's very important for coronavirus testing. We need more testing. Every expert we talk to says we need more testing. And the reason you need more testing is because you need to intervene early, if you can, and you need to know whether the virus is growing in your community or receding in our community. Most recently, as I said, we passed the third bill to mitigate the economic impacts of this pandemic. The city of Bowie has already received, Mr. Mayor, Council, as I think you know, $116,000 through the Community Development Block Grant Program. And of course, there will be more to come. And we're talking very much about how we need to get more money for local governments less than representing jurisdictions of less than 500,000. And we are doing that. all of you on the line ought to know if you're in the 75,000 to 99,000 and below, you will be receiving over the next 6 to 8 weeks a check for $1,200 for every adult. Now that check will reduce as your income goes up from 75,000, but if it's under 75,000, you'll get 1,200. And if your wife or husband is in that category, they'll get 1,200, and you'll get $500 for each one of your children. That is to try to make sure that we have families who have some resources to put into buying things that they absolutely must buy. In addition, for those unemployed, we have a $600 additional payment above and beyond the unemployment check you receive. And we've also got a huge sum of money which is going to be given to small businesses. They will take a loan, and that loan will be forgiven if they keep their employees on the payroll. Very, very significant, and obviously we're probably going to need more resources for that. We did $100 billion for our hospitals, $17 billion additional for veterans care, and funding to help ensure the coronavirus pandemic does not disrupt our elections in November, as we see in Wisconsin today. There's $150 billion for local and state governments and tribal governments. Together, all of us on this phone, all of us who you've given the honor of representing you at one level on the school board, the county council, the county executive, the mayor, and city council, every one of us needs to work together to flatten the curve and protect the most vulnerable. Only when the public health experts tell us it is safe to do so can we begin to reopen our economy and get back to somewhere near normal. Experts tell us that will not be quick, but we need to be tolerant of one another, be patient, but also be very focused on making sure that we follow the advice of our health experts and stay 6 feet from one another, wash our hands on a regular basis, wear masks, and stay at home. We heard from Dr. Gottlieb, when I say we, as the majority leader, I have a council of members, and we get briefed every week on a different subject. Dr. Scott Gottlieb, who worked for the Trump administration, is now with the American Enterprise Institute, made a very cogent comment on the briefing today. He said, we've got to be cautious when the experts tell us that we can get out and about, that we do not try to get back into regular life too early. May go to work, but we need to maintain distance. We may see people on the street corner, but we ought not to shake their hands. His point is, if we don't be careful, we risk the virus exploding again. I'll continue with all of you and all of the people who've spoken to you, work closely with the city of Bowie, Prince George's County, the state of Maryland, and the rest of our delegation to ensure that Maryland and the 5th District get the resources they need to combat this virus. Let me say something about Governor Hogan. Governor Hogan, all of us believe, has done an outstanding job. He's been one of the leaders in this effort, and we very much appreciate his efforts to make us all safe and to confront this virus as effectively as possible. As I said, we're all in this together. My office will remain on the job. Like so many of you, we're working in our homes, but we're connected. And if you call our office, somebody will answer the phone. If you need help, we can give you help. We want to flatten the curve, but we want to make sure that every one of you on this phone, everyone in our community, comes out of this stronger and better. Now, let me close with saying you can go to my website, Hoyer, HOYER.house.gov, G-O-V. And there's a lot of information that I'm not going to go over now, but that you will find helpful, and numbers and addresses that you'll find helpful as well to access the resources that we have made available so you and your families can be economically better off and safer and healthier. Again, thank you very much for giving me this opportunity to participate in this forum.
Thank you so much, Congressman. I know we want to get to questions. I want to take just 1 minute to allow my city council colleagues to say a couple words, and then I will pivot to city staff so we can get the questions that you guys so desperately want answered and need answered soon. So with that being said, Councilman Wolfley, do you have anything you would like to add?
Thank you very much, and I'll pass on saying too much. I just want to thank everybody for participating and encourage everybody to continue looking at our website, the city's website, for ongoing information. And I'll leave it at that, and let's see if we can take some questions after others have a chance to.
Thanks so much, DeFore. Councilwoman Harrison?
Thank you, Councilmember Guapo. Just wanted to specifically thank you and our mayor, and colleagues, city staff for putting this together. And thank you very much for all of our great elected officials who have joined us on this and provided such wonderful information to the residents of Bowie. And certainly want to say thank you to the residents for being here and for just all the support you have provided to your neighbors. And let's just keep that going. That keeps us positive on a day-to-day basis, and certainly helps keep our community strong. And as Councilmember Wolfley said, please stay tuned to the website for updates. We have daily updates, so please continue to monitor that. And we look forward to your questions. And if you need anything, please don't hesitate to reach out to any of us. Thank you.
Thank you, Councilwoman. And lastly, Councilwoman Ndebumadu.
Thanks so much. Thanks so much for putting this together. Like everyone said previously, it's just a pleasure to be able to host this call with all of the other elected officials. So thank you all for joining and being willing to provide these updates to our Bowie residents. We are eternally grateful. Just also want to say thank you to city staff. City staff has been working tirelessly, especially our city manager, Al Lott, been working tirelessly through all of our efforts and making sure that our residents are taken care of and that the city is moving at a speed in which our residents feel safe and they feel like they have everything they need. So just want to give a big thank you to city staff. And then lastly, thank you to all the residents that have sent emails, that have sent ideas and ways that you can step up and participate. We are eternally grateful for those ideas and really just happy to know that during this time, you are all stepping up to help your neighbors and help us and just send forth these ideas on what you think that we can be doing better. So thank you for holding us accountable. Thank you for always being there, and thank you for the ideas.
Thank you so much, Councilwoman. And I know Councilman Stev is listening in and just sent me a note that he does not have anything to say. So with that being said, we will get to the question and answer portion. Before I hand it over to city staff, let me just announce all the folks who will be participating in the Q&A session. And as Una's mentioned earlier, we are going to try to get to everyone's questions. But if we do not get to your question, we'll try to set up a system so that we can follow up with you guys. With that being said, we have a couple of great stakeholders from across the region who are with us. We have Sai Alba, who's a partner of government contracts at Palera Mazza. We have Lisa Smith, who's the executive director of the Bowie BIC with us today. We have Michael Harrison, who serves as the director of policy for the Department of Labor under our Secretary of Labor. We have Al Lott, who's our city manager here in the city of Bowie. We have Lee Cornwell, who serves and has been doing a fantastic job as our Director of Emergency Management here in the city of Bowie. We have Chief Aneski, who's our Chief of Police in Bowie, who's also been doing a great job. We have a representative from the Bowie Chamber of Commerce, Stephanie Anderson and Terry Rogers. We also have Mark Wells, who is the representative from the Small Business Development Center at the University of Maryland. And a last minute addition, but so greatly needed, we have Miriam Martin, who's a medical director and the director of medical awareness for the Emergency and Family Medicine Center. So with that being said, Una, I will pass this on to you and let you take that from there.
Good evening, ladies and gentlemen. Thank you for joining us this evening, and thanks to all of our speakers and panelists. who are participating in Bowie's first ever virtual Q&A session. So far, so good, I think, but bear with us. This is new for all of us. I'm Una Cooper. I'm the communications manager for the city, and I'm going to be moderating this portion of the town hall meeting. Things are moving really quickly. We know the numbers are climbing. The new guidance is coming out almost daily. So I know we all have questions. In fact, we've received almost 50 questions from the Bowie community just since we started publicizing this event last Thursday. And I think we have another 30 that have come in just since this call started. So with that, we're going to jump right in, try and get to as many of you as we can. During this session, if you have a question, you can submit it through the Zoom app, or you can email it to publicinfo@cityofbowie.org. If we don't get to it tonight, and I can guarantee you we're going to try, but we will not get to all of the questions, we will provide the answers on our website afterwards. So with that, let's begin. And we're going to start with Lee Cornwell, who is our emergency manager. He's the point person for the city of Bowie on this. And Lee, we're going to direct two questions to you to start. And in terms of the questions, I'm going to try and hit the ones that have been asked by several people first, because obviously that's what all the questions are important, but I want to get to the ones that a lot of people are wondering about. So this first one, Lee, is Prince George's County has the highest number of COVID-19 cases in the state. What is the city of Bowie doing to prepare for the coming surge and to protect its residents? And that's from Susan, who says, thank you.
Thank you, Una. Yes, unfortunately, Prince George's County has taken the lead in the state for identified coronavirus cases. Now, everybody might think at first that number is high, and why are we leading the state? A couple of things that come to mind. First of all, our population is so great within the state of Maryland, and because of that, we're doing a lot more testing than other jurisdictions. But we are identifying more people that have contracted the virus. It does not necessarily mean that the county as a whole is leading the state in the coronavirus. It just means for right now that we have identified more people within the county that currently is suffering from this virus. Now, what have we done to protect the people within our jurisdiction, our great city of Bowie? We have done some very proactive things within the city. The main thing that we're doing is just plain communication. We are getting the word out to everyone in every format that we can think of. We are on our website every day with information that we receive. Every day we have 4 or 5 conference calls, starting off at 7:30 in the morning with the state of Maryland and the Maryland Department of Health. We then provide information to all of our directors within the city, and we get positive feedback from them. And we, as a team, managing this critical incident within the city. Then at 3 o'clock, all of the emergency managers within the state of Maryland are on our conference call, and we discuss our issues, and we share information, and we get new ideas and put those new ideas into practice. So every day we're putting new information out, and you can follow that information on our website at cityofbowie.org/corona. There's a lot of good information there. So we are just practicing what we preach, in that we in the city are taking care of our staff by most of our staff is now teleworking from home. That all the staff that is able to do that. Of course, we have staff that cannot do their work from home, such as our police officers, our solid waste personnel, and others. And they must come to work in order that we can continue our essential services. But we are putting information out for social distancing and what to do. And we are providing resources to our senior citizens in the form of we have our Neighbors Helping Neighbors program, where we have about 50 volunteers that go out and help our senior citizens in our disabled community, and looking after them and seeing if we can provide any resources towards them. Our senior center is also delivering our homebound residents with meals every day. Those registered in that program are continuing their meals. Usually they go to the senior center and get those meals on a daily basis, but since our facilities are closed because of the coronavirus, we are providing those meals to those residents in their homes. So we encourage everybody to stay in tune. Look for information on our website. Look for information on our social media, our Facebook and Twitter. We've put out a couple of videos now, very informative, that is a lot of good information there. So we are in constant contact with our county partners, our county health department, our state health department, and the Maryland Emergency Management Agency. And we are, just let me tell you how this incident is managed. The coronavirus response is managed locally through our Prince George's County Health Department. They are the ones that are running this locally. The management of the overall incident is managed by the state of Maryland, the Maryland Department of Health. And then our federal partners are supporting all of those agencies. So from the federal government on down, everybody is concentrating on providing the citizens with the best response we could possibly do. So that's what we're doing to protect our citizens and providing all the resources that are necessary to them.
Okay, thank you, Lee. All right, next, I'm going to ask some questions. We've gotten probably a dozen of them about the number of cases of COVID-19. People want to know how many there are here in Bowie, in the surrounding area. Are there hot spots? How many deaths? And then this one came in tonight from Vince. It says the Anne Arundel County Department of Health posts on their website the number of infections by jurisdiction. When can we expect the county to provide this information by jurisdiction to Prince George's residents?
Una, this is County Councilman Turner. So let me try to address that as best I can. And since we have our state partners on here as well, as Lee indicated, the state of Maryland is being the lead partner as a statewide response, and they, as the Department of Health, State Department of Health, are collecting all the information with respect to positive, negative deaths as part of that. That information is funneled down to the Department of Health, but there are both federal and state laws that require limited release of that information. Obviously, we learned today that Anne Arundel has instituted this kind of geographic mapping system. We've tried to address this issue. The Maryland Department of Health actually just did a memo yesterday indicating that they were not going to release certain amounts of information as part of that. And so that restricts our Prince George's County Department of Health from releasing similar information. So obviously, we just learned today that what Anne Arundel is doing. So we're going to follow up as soon as we can to make sure that we are able as Prince George's County to provide that information, because that was the instruction that we were getting from the state. The other thing I will say is that somebody had requested a question I saw earlier about where to get this information. The state is providing that information off of their COVID website. They do daily updates at 10 a.m. every day with respect to testing results, deaths, those who have come off or have recovered as part of that. I know Prince George's County is looking to mirror that information. We also, I believe Governor Hogan announced today, based on the request of the state legislature, to provide additional information, including racial background of people who are testing positive, in order to see if there are hotspots or certain communities that are impacting. I can simply say in response to the previous question about why Prince George's County is leading, it is fair to say, although maybe not in the Bowie area, but in Prince George's County totally, we are a community that has health issues as a community. And that's why we brought the University of Maryland Medical System into Prince George's County and building the new regional hospital at Largo. And they operate currently now, obviously, the Bowie Health Center, as well as the Laurel facility. And so we're working directly through the County Department of Health with our hospital providers in order to address the surge issue. We're actually going to bring the Laurel Regional Hospital back online because it was transforming into another type of service, and that's hopefully going to be done by the middle of this month. So we are trying to prepare as best we can, but we are in some ways limited by both what the state and the federal government is doing with respect to resources, even though Congressman Hoyer said the great activity that Congress did, that is taking time to flow down. And I don't have to go into any details. Anybody who's reading the papers about, being a little bit slow on the response on the federal side, despite the activity of Congress. So we are continue to work on that. If we can provide that information, we are looking to do that as a county in order for us to provide that information, not so much to the public, although that's where the interest is, but also to our county and municipal governments so they can respond accordingly as well. So I'll leave it there for now.
Thank you, Councilmember Turner. Next, I'd like to turn to Chief Neske to talk about the enforcement of the stay-at-home order. We have a lot of very specific questions about various situations, but I thought I'm going to read one of them, and then Chief, if you'd like to talk about how you're enforcing the order after you answer the specific question, and then where can people go for information about the answers to their questions about the order. So this question is, before COVID-19, I traveled by car to visit my mom. I'd like to know if I travel to visit her now, will I be able to get back into the state of Maryland? This assumes we're both healthy with no signs of COVID. Thank you. And that's from Viola.
All right. Hello, Viola. This is going to depend on where your mother actually lives. If they're coming from any of the states such as New York, New Jersey, Connecticut, Chicago, Illinois, that has a hotspot, you're going to need to quarantine after you come back for 14 days, whether you're symptomatic or not. And so it really depends on where you're going. I know they banned non-essential travel through air. We're not at the point where we're checking cars coming in and out of the states. But again, that's going to be upon you to know where you've been, where you're coming from, and the state of that area that you're leaving, so you know if you need to quarantine or not. That's just a few of the spots that you need to quarantine when you come back. As far as enforcement, we do get a lot of calls, or a number of calls, for enforcing the number restrictions of number of people in a group or non-essential businesses. We're working along the state guidelines of we seek voluntary compliance. The last thing that we really want to do is have to write a citation or make an enforcement action when everyone else honestly has a lot of other things on their plate, and there's really no need to ramp tensions up between people. So we're going to seek voluntary compliance first and foremost, educate, to steal a line from Chief Stawinski, educate and encourage. But we're going to go that along those lines. If we have to, we'll take stricter enforcement, through charging. But so far, we have not had to do that at all. People understand once we tell them what the directive is, remind them again what the directives are, and get them to comply. There's a lot of different ways you can find out. I know that UNA puts out updates daily. We have a COVID section in our city website, which has all the pertinent documents and updates. Maryland State Police has been outstanding with sending out guidance and guiding documents, listing what's essential, what's not essential, how do you interpret some of these things, because it can be a little confusing. We're at stay home, but you're allowed to walk. So it really opens the doors for some questions. And that's a great one-stop shop for finding those answers. I've also just put a chief chat out, a little video that's on our Facebook page or Twitter page. If you don't follow us, I strongly encourage you. It's a good source of information, and I will leave it at that so we can move on.
Thank you, Chief. Just a commercial break for a new website that was stood up today by the state of Maryland. It's a rumor control page. And I checked it out. There's about a dozen questions there, and it's a great source of information. And not only does it answer the question, but it cites where the answer came from, whether it was the governor's order or guidance or whatever. But I think you'll find it very helpful. And we have a link to that in the homepage of our website. Okay, on to the next question. We're going to switch to talk about some of the medical things. And for that, we have Dr. Miriam Martin on the line. First question here is, how long does it take for someone who is a carrier of the virus to be healed so that they don't infect people?
Hi, that's a very good question, and it's hard for us to know that because we aren't regularly and routinely testing individuals who are asymptomatic carriers. So if we indeed were able to test them, found out they were positive, and then later on could retest to find out they're negative, that would give us the answer to that question. But because we don't have enough tests, everyone's not getting tested. So the individuals who will get tested are those who are hospitalized and have signs and symptoms that may be consistent with COVID-19 infection, or if you're symptomatic and older in age, 60 to 65 years and older, with chronic medical conditions. Those may include hypertension, diabetes, heart disease, chronic lung diseases, cancers of some sort. Then you would be tested. If you're a healthcare worker, and you have symptoms within 14 days of close contact, you'll get tested. So that's a problem right now. We're not testing everybody, so we can't really give you the information on how long you are a asymptomatic carrier of COVID.
Okay, thank you. Next question is, if we are all to assume we could be carriers, does it ever really go away?
Again, that's the same premise. Eventually, just like I would presume with any other infectious disease, at some point it does go away. Some things we test for instance, strep throat. We can test you for it and test you again to make sure it's cleared up. If indeed we were testing for COVID or asymptomatic individuals, we could get that information. So I can only presume, yes, at some point it will go away. When it does, we just don't know. We know that the incubation period is 2 to 14 days from the initial contact. But as far as how long an asymptomatic person is carrying that around, it's very hard to determine that when you're not doing routine testing of everybody in the community. So I would recommend that we all kind of presume we are asymptomatic carriers at this point during this pandemic.
Okay, that sort of leads into two other questions. One about testing, and when is it going to be available in Bowie or nearby? Will being exposed to a suspected case qualify one to get a test? And
Okay.
yeah, okay. And can you get a test if you're asymptomatic, which you kind of already answered that one.
Right. So I'm a healthcare worker and I work in the emergency room and I don't qualify for a test. And that's because I'm asymptomatic. Now, if at some point I develop a symptom, a fever, a cough that's different, and I'm a healthcare worker, then I would be tested. So everyone's not getting tested. That was answer, I think, to one of your questions. And what was the other question? I'm sorry.
Sorry, let's see here.
I think it was when everybody's going to be tested in Bowie.
Yeah. Are there going to be tests available in Bowie?
I mean, they are testing in certain Bowie locations, so it's already available. I know at the Bowie Health Center, if you present there and are seen by a physician, they can order the test. At most of your satellite spots or your drive-throughs, you must have a physician order to get a test there. So we are testing in Bowie, but it's not as widespread as we would like. not only in Bowie, but all over the nation.
Okay, thank you. That sort of leads into masks, where there's several questions about masks. Is it necessary to wear a mask when you're out walking in your neighborhood? And that comes from Mary. And I'll let you answer that one first.
Okay, hi Mary. So we're recommending now that individuals wear masks, not necessarily walking outside in your neighborhood, but if you want that extra piece of comfort, you can. If you're out walking around, make sure you're at least 6 feet away from someone else out walking. You might want to cross the street, that sort of thing. But the fact you're outside, you're not in an enclosed area, is not as risky as being inside. So that's probably personal preference. But definitely if you're out in the stores, you have to go shopping, to a doctor's appointment or whatever, individuals should have on a mask.
Okay,
and now, go ahead.
Sorry, didn't mean to cut you off.
That's okay. I was going to go a little further and just say what types of masks are acceptable. We're asking that the N95 masks be reserved for healthcare workers, and the availability is really getting low in some places because the first frontliners are the ones who are actually in most danger and are working closely with patients who are potentially COVID infected. There are ways to protect yourself with a surgical mask. People are making masks. However, the fabric masks are breathable. So you need to put a filter inside of that mask if you're going to use it for protection as far as COVID. The recommendation to start wearing masks really stems from those asymptomatic carriers a lot because they're the ones who are potentially infecting a large percentage of our COVID infected individuals. They don't even know they're infected. They're passing this virus along. So wearing the mask helps cut down that transmission.
Okay, and there's a couple other questions about masks, and this isn't really a medical question, but more an access one. Given that the CDC now recommends that the public wear masks, might the city of Bowie distribute masks to residents, especially to seniors who find that through staying home, they may need to go out for some essential reason? And that comes from Diana. Others have asked where to purchase them. Is the city going to provide material, or how can they get material? A whole lot of questions about that. Another one about grocery store workers and other store clerks not wearing masks, and is there any way to make them wear them? I will, do you want to start with that one, Lee, and then anybody else can jump in?
Sure, that's a good question and a pretty tough question to try to answer. Let me go with store workers first. The guidance that we've gotten from the CDC and through the Maryland Department of Health and the Prince George's County Department of Health, the guidance is that everyone that goes out and about has to wear masks. This should include any workers who are out there working. They all should have masks on. However, this is not an enforceable issue. The only thing that we can enforce right now is the gatherings of 10 or more and the non-essential businesses that are still open. The things that we are doing, though, is putting communications out, directing people or about what to do, what kind of mask to wear, where they can get them. Right now, the city is not providing any masks to the general public. There are some instructions that we will put on our website in the next day or so of how to make your own mask and where to get those kind of materials to make those. There are some people that in the city and around in Maryland that are making them, and you can go onto the web and try to purchase them yourself. And there's also commercial type of masks that are available now for purchase. So I hope that answers that question.
Okay, thank you. We're going to pivot here to how people are being affected by the stay-at-home orders. So let's talk for a moment about unemployment. We have several questions about that, which I'm going to ask Mr. Harrison to chime in on these, but I'm going to read through 3 or 4 of them. The first says, I would like to know, well, this one actually, this has to do with employees. How, when employees are laid off, how are those services still being provided? This next one is, I'm a resident of Prince George's County and I've lost my job. I'd like to get more information about financial relief Governor Hogan set out on April 3rd and ways to apply for it. Another one has a question about how long it's taking to get a response. And this third one is, hello, the federal government is offering relief for self-employed people to apply for unemployment. I've been trying for 2 weeks to apply and was told applications are not yet available. That self-employed people cannot use the same application as unemployed residents. Please explain this and explain how long it would take to get benefits. Thank you in advance for your help. And that one is from Jacqueline. So Michael Harrison, please.
A lot of those questions on town halls. The federal government is sitting on a stimulus checks up to $1,200 for individuals and $500 per child. And this was designed to kind of be a bridge for unemployment. The CARES Act passed by the federal government adds $600 on top of state benefits for everyone receiving unemployment benefits. If you have lost your job or have had your hours reduced due to the virus, you are eligible for unemployment benefits. The state maximum is $430 a week. On top of that is the federal $600 a week until July 31st for a maximum of $1,000 and $1,030 a week. You would go to our website. If you Google Maryland unemployment, the website will come up. There's information on the process. We have a lot of frequently asked questions for new users. There's a phone number to take phone application. We're encouraging everybody to do it online. Online is going to be your best and quickest options. Our phone lines are jammed with the influx, and we're getting to as many people as we can, and we're ramping up staff and service, trying to get through the surge as quickly as we can. Unfortunately, it's taken a lot of people a lot of time, and it's very frustrating. We understand, and we're working as quickly as we can to process as many of these unemployment benefits as we can. If your benefits have expired, Congress has also extended benefits for an additional 13 weeks. So if your benefits have expired, you can apply for an additional 13 weeks. And if you are currently on unemployment, your benefits will run for 26 weeks for the state benefits, plus an additional 13 weeks that Congress just passed. For independent contractors, sole proprietors, gig economy workers, this is a new federal program that Congress passed. The state is working as quickly as we can to implement this. It's not happening overnight. And unfortunately, that is leading to a lot of frustration from independent contractors, understandably so. But we are trying to be able to accept these new claimants as quickly as we can. People are encouraged to apply online, go to our website for more information, and you can enter your email on our website to receive a notice when the independent contractor, gig worker applications will be available for you to apply for benefits. So I think that addressed the question. Thank you.
Thank you. Have to do with business and assistance for these are for Mark Wells. what can a business do? What kind of loans are available for businesses, and which ones are not, do not have to be paid back is the first one. And the second part of that is what is the financial limit for federal small business loans? And can you pay your federal income tax with these small business loans? So Mark Wells, are you still on the line? Mr. Wells?
Can you hear me?
Yes, we can now. Thank you.
Okay, I'm sorry. I'm technically challenged. Yeah, there's several loans that are out there, and there's several. Also, the grant from the SBA just expired today at 7 o'clock, so there's no longer a grant out there for more lenders. But I'm proud to say that Prince George's County picked it up, and they're on the 13th of this month, they will have a grant, and they also will have $1,000 loan available that will run through FSC first through Shelley Brothers Way. And I think that will considerably help, because I think that's the niche for Prince George's County, is that under $100,000 need for a small business. Now, but if you go to our website has www.marylandsbdc.org has a survival kit. And if you scroll down to the survival kit, it gives you all the loans that are available for the state and all of the programs, the PPP program. I don't know if you're familiar with that, but that's based on your W-2s that you have to pay out for your 1099. It's an excellent program for a larger business. For the smaller business, I recommend that they go with the EILD, which is the program that just gives you working capital. And that program goes up to $2 million. So there's a lot. And we have so many in the state, I would consider subject matter experts that can help you get through this program. The only thing that the program it changes every day from the SBA. So we're staying on top of that. So honestly, they need to contact us to make sure that they're putting together the right application to get what they need. And so I think that SBDC is on point with everything that we need to do. So
Okay. Could you repeat how they can get in touch with you, and also that website you mentioned, the toolkit, again, please?
Okay. www.maryland, spell it out, sbdc.org. My email address is mwells14 at umd.edu. And my phone number is 240-714-7223. And I have a counterpart, that's Deidre Lee, that is actually in the FSRC, which is doing the next wave policy for the grant. Because I think the grant is the most important thing for Georgia County, because a lot of micro lending, they don't want to be able to have to pay it back. These 3 months can put a lot of businesses out of business. So with that grant, it secures a person, and if the 3 to 6 months, if they can do it, people that are making under $150,000 and only have 2 employees, I think it's a really good option for them.
Okay, thank you. And do you know the answer to the question about being able to pay federal tax liability with one of these small business loans?
I don't know the answer to that, but from a banking standpoint, because I'm 25 years a banker, most of the time they're going to give money to pay previous federal tax. Now, if you have tax behind this emergency or the disaster, they might be considering that, but they're not going to pay previous tax. No.
Yes.
County Councilman Turner, you might want to turn to Lisa Smith from the Bowie Business Innovation Center. We've been working with them, and they're going to be providing some assistance to Bowie area and other county-based businesses. And so maybe she can announce what's going on with that. What we're finding is people are aware of the programs, but they're having difficulty actually applying which one's best for them. And so they kind of need that technical assistance. And so between the Bowie BIC and the Bowie Chamber of Commerce, they've been working very hard to try to assist the businesses locally about all the federal, state, and now the county programs as well. So thank you.
My office is in the Bowie BIC, and I work very closely with Lisa.
And we're glad it is.
Lisa, is there anything you'd like to add to that?
Yes, I would, because I've noticed certainly there's a tremendous amount of information available for businesses coming from the SBA, coming from the state, coming from the county, and it's a little overwhelming, and it is changing pretty much every day, as has been noted here on the call. But one of the kind of missing pieces that we've seen, and then with the encouragement of Chair Turner, we put our heads to work on it, and we realized that what companies need is a little bit more of a how-to navigate these different loan packages and these different grant opportunities. And so to address that, the Bowie BIC, together with the Maryland Women's Business Center, Mark Wells, if he has time for us, and FSC First, on Friday, we are coordinating a Zoom call where we will look specifically at the federal programs, grants and loans available, as well as the county programs that are becoming online next week, so that companies can get a real succinct piece of information about what's entailed, what's the eligibility, and then what's the mechanics of applying. And so we'll be working through our promotional partners at the Greater Bowie Chamber, the City of Bowie, FSC First, Prince George's County Economic Development, kind of get the word out about that. But that's something we want to really try and do this week as companies prepare for what can be happening with the county loan opportunities. And I just want to say, give Chair Turner a shout out for really kind of giving us a nudge and seeing clearly that this was something, a need that we need to address right now. And so that's what we're doing.
Well, Lisa, I appreciate your input, because it's clearly a team effort over there at the BIC. And all of us are putting it together, trying to make sure Prince George's County and the City of Bowie.
Right, and the Bowie BIC is the largest concentration of scale-up resources in the county at this point. In fact, we have the largest business accelerator program, and we have on-site counselors like Mark Wells from SBDC, Angie Duncanson from the Women's Business Center, Mary Kolick from the Procurement Technical Assistance Center all the time, and we're taking all of that virtual. So, once we get through this week, we'll be promoting more of these virtual opportunities for companies to sign up and talk on the phone with our companies, or talk with our counselors, or be part of Zoom calls. And so watch that space.
Sounds like a lot of good help there. This next question is for the representative from the Bowie Chamber of Commerce. And it has to do with what businesses are still open, which ones have deferred to carry out delivery. Is there any kind of listing about that? And then what is being done locally, and anyone can chime in on this, but we'll start with the Chamber first, to support the small and locally owned retail businesses in Bowie.
Okay, good evening. My name is Stephanie Anderson, and I'm the president of the Chamber. What we have been doing for our members is they have been, those that are authorized to be open and deemed essential under the governor's executive order, we have been advertising their businesses and pushing it out to our email list and letting our members know that they're open. We do not have a comprehensive listing of the businesses that are local. I do understand that the Bowie Patch had started a list, and also Bowie Living had also started a list of local businesses that are open. But I think that anyone should feel free to contact our office at 301-262-0920, or you can send an email to info@bowiechamber.org, and our executive director, who's available, Pauline Markward, would get back with them.
Great, thank you very much. Okay, now we're going to switch to some, these are getting to be more individual questions, but I think they probably apply to a lot of people. This one is, in some states, Virginia being one, senior centers are making deliveries on prepared food. Do we have any such services? And I'm going to take that one. The city does deliver food, working with the county through a program at the senior center. If anyone needs information about that, they can call the senior center at 301-809-2300. And Lee Cornwell mentioned our Neighbors Helping Neighbors program at the top of this. And that's a program where volunteers have signed up to go shopping or to pick up grocery shopping or pick up prescriptions for seniors or others who are disabled. And so far, we've only had 6 seniors take us up on the offer to match them with a volunteer. So we really do encourage people to take advantage of that program. And that's again called Neighbors Helping Neighbors, and it's run through our senior center. Next question is, my mom owns an assisted living and has to feed 10 people. She goes to the grocery store twice a week because grocery stores are limiting the amount of food she can buy each time. Are there any exceptions on food restrictions in situations like this? She's also a member of a vulnerable population and would like to decrease the number of times she goes out. There's other questions about, and the chief sort of answered these before, but making sure that people are doing social distancing in grocery stores, and why aren't grocery store workers and their vendors being considered as first responders during this? So if we could start with the assisted living one. I don't know if anyone wants to jump in on this. Lee, do you want to take a start at it?
Yeah, I can start with that. Most of the stores now are limiting the amount of people that are going into the store. We just got notified today that all giant stores in the state are going to be limiting the amount of people inside of the store at one time. A lot of stores are going to one-way aisles to prevent people from passing each other and following the guidance of the social distancing guidelines. You might want to try services such as Peapod or Instacart, where you can go online and order your groceries, and those groceries can be delivered. Most of the time, you can get exactly what you want. You don't have to go out and about, and you can get your groceries that way fairly easy. That's what I would suggest.
Okay. This next question is about services for immigrants. It's sort of long and involved, but let me just summarize by saying people that are uninsured and maybe possibly illegal, are there services that can help them, and are they going to be eligible for some of these programs, the federal program with the funds to each person, the stimulus one? Anyone want to answer that?
Una, this is County Councilman Turner again. I
was hoping you'd do that one.
For the county-based programs, we will not be, for both the employee relief program, which is operated through the Employee Prince George's, as well as the business relief program, we will not be looking at undocumented status as part of those programs, as long as you meet the other eligibility requirements for those programs. However, I believe with some of the state and maybe the federal programs, obviously that may be something that they look at to see whether or not you're eligible for those. So I'll defer to our state and federal representatives on that. But for the county-based programs, you will not be looking, as long as you meet the other qualifications to participate in the programs, and then you can apply for those programs. The one thing I will say for the county-based business relief program, which is both a grant program and a loan program, it does require a business to apply for either the federal or the state programs, or at least provide information that you had applied. I know we learned today that several of the state programs are no longer open because of the demand and the amount of applications they receive. So I just wanted to make that caveat. That's part of the application process for the county program. So those businesses, if they have applied for the state program, that's fine. If they haven't, then they're going to be shut out for the state program. So they definitely need to apply for the federal programs. Thank you.
Thank you, Todd. This next question, maybe you can take a stab at it, Dr. Martin, please. It comes from Angela, and it has to do with tracing cases and reporting. If an individual has been infected and self-reported locations they have visited, for example, the gas station, supermarket, post office, what obligations do these locations have to make the public aware that an infected person has visited, or what obligation does the person have to make their infection known?
Okay, that's a good question. So the business itself, to my knowledge, has no obligation to report that. However, we as individuals in the community, as I said before, need to assume that everyone is potentially positive. So you're going to take the same precautions regardless. The person themselves, if they know they're positive and have been diagnosed as such, their obligation is to isolate if they're symptomatic, or quarantine themselves if they're waiting for a positive test result. So to my knowledge, there's no obligation to report, but we as individuals in the community do not really need to necessarily have that information if we have the mindset that potentially any one of us could be a carrier and not even know it, and it would be nothing to report. I hope that answers that question.
I think so. Thank you. Mr. Lott, this next one is for you. The question is, how are sanitation services being impacted by the COVID situation? And that comes to us from Kimberly.
Well, good question, Kimberly. Our sanitation workers, our solid waste drivers and collectors are still collecting our twice a week for solid waste and trash, and once a week for recycling, and once on Wednesdays for yard waste. However, in order to protect them, we've asked that everything be put inside the containers, and that they don't have to pick up any bulk items or any cardboard that's laying out. And so we've asked people to put things in the bins, and so that our people will avoid any contamination. Our solid waste collectors and drivers are very important to us. They are keeping us from having a magnification of the health issue by having too much trash out that can't be collected, and so we have to protect them. And but we promise that as soon as this is over and we get close to normal, we will start collecting the same way we did before, which was the best trash collection, recycling collection in the county.
Thank you, Sarah. Chief Neske, this one's for you. Is crime decreasing because everyone is home? Which crimes are most common these days? I've heard of someone going around knocking on doors and handing out masks laced with chemicals. And then they pass out and the people rob the house. Any word on this? Anything we need to be thinking about while we're home to take precautions as it relates to crime?
All right, I am not going to jinx myself by saying crime is down. We are seeing less activity, but I will say that we did have some thefts from auto last week. 3 in one section, I believe 2 in another. So the lock it and or lose it still applies. Just because we're inside doesn't mean that the bad guys are. So as far as your question about people being drugged and having their house broken into, we have not seen anything about that at all. I haven't heard anything about it in other jurisdictions. That might be one for the rumor website. But we are typically seeing less foot traffic, less people out and about doing the casual stuff. Maybe smoking the marijuana on the corners or at the lakes or wherever. We're seeing less of that actual foot traffic. Statistically, we're down a little bit activity wise, but I won't go as far as to say that crime is going to be trending down because the bad actors are still out there. If they're not paying attention to the laws, they're not going to pay attention to executive directives. So the usual applies of locking your doors, making sure your valuables are outside of the vehicle, not left inside, and taking the usual precautions that we should be taking every day outside of the pandemic.
Okay, thank you. This next one is from Liz, and the question is, does Bowie have a hotel or other facility for a person who is entering from out of state to self-quarantine for 14 days before rejoining their family here? Lee, you want to take this one, please?
Sure. At the present time, no, but we have been working with our economic development director, and we have identified a few hotels within the Bowie area that are willing to discuss those options. There's a lot of questions that come out about that concerning how do you do that, how to protect the staff, how do you protect the other people that are just visiting those hotels and are not there for quarantine purposes. So, but on the other hand, we have not had any requests from the public for that. We have let Prince George's County Office of Emergency Management know that we have identified a few of those hospitals, a few of those hotels. We've also let the State Emergency Management Agency know that. So when we start getting requests specifically for Bowie residents of that, we'll explore those options in the future.
And this is County Councilman Turner again. Just from the county perspective, we do have a couple of hotels where we can quarantine, but that is for first responders who have to self-quarantine and do not want to impact their families at their home. There was also consideration for certain populations, particularly the homeless, as an opportunity also to quarantine as part of that. If there is a need, and we'll rely on our municipalities to let us know if there are needs for other types of quarantine. I think that's something that we would be willing to work with the city on as well. Luna, I think you're on mute.
Sorry about that, everyone. Okay, this question is about you've seen on social media the pictures of masks and gloves being discarded in parking lots. The question is, will you please send a PSA to residents to stop discarding masks and gloves all over the parking lots and sidewalks? I will take that one and say, yes, we will. We will keep on doing the messaging we've been doing on that and expand it as well. So thank you for that one. And we are just at the 9 o'clock hour, so I am going to do the last two questions and then ask if anyone wants to make any final comments. This one is about whether or not the farmers market will be able to open. And this is something we are looking at Lee, do you want to answer that one or shall I?
I have not gotten any guidance from our partners at the health department on that as of yet. I can look in that and provide an answer on our website in the next couple of days.
Okay, and thank you. And a related question is it permissible under the stay-at-home order to go out and purchase plants to grow your own food at this time? Chief, you want to take that one?
Yeah, as long as the store's open, if it still falls under the Home Depots and the Lowe's are still open because it's household necessities and repair necessities. So if you go out to that store and they have what you're looking for as far as you're planning something to try to grow your own food, then that falls within the restrictions.
Okay, thank you. And the final question is, I feel more needs to be done to ensure local businesses are adhering to the governor's social distancing order, and that Max requests and that they are requesting their sales staff to wear masks. I have not seen enough being done in this place to protect the public or the employees from the spread of the virus. Chief, do you want to just reiterate what you said before about how you're enforcing and what you can do?
Sure. The masks are a general guideline and CDC recommendation now. They are not a directive that falls under any kind of enforcement action. Right now, it is still voluntary. So while it may be good practice and a recommendation, we don't have any enforcement on that piece of the puzzle.
Okay, thank you. Okay, with that, I am going to wrap up. There were several questions we did not get to specifically. We will compile those, get answers, and we will restate the answers to the questions that were made on this call today wherever we can, and share that through our various means in the daily updates. If you haven't signed up for Alert Bowie, I'd encourage you to do so at cityofbowie.org/alerts. And I will go back to Mayor Adams. Would you like to make some closing remarks, and then we can go from there?
Yes, very briefly. First and foremost, I'd like to thank all of the participants for tonight and trying to shed some additional light on some of the issues and questions that the citizens have. Again, I do want to say thank you to the staff. Again, to all those who are working so diligently and so hard to keep the city of Bowie moving forward and providing the services that our residents so desperate. I do want to make sure that I remind everyone, as we've heard several times, to please check the City of Bowie website for links to various information. There's a great source of information for you there. And again, that's at cityofbowie.org. And if there are any nuanced questions or anything that may go, please feel free to hit me at timadams.org. But the City of Bowie has links to all of the major websites so that you can gather the information you need. Again, thank you all for being here this evening. Thank you again for the support that we've gotten from all of our speakers tonight, but most importantly, to those who answered those very serious questions. I ask everyone to please stay safe, to shelter in place as much as you can, stay home. Again, if you go out, please just try social distancing, washing the hands, and doing all the basic things that will help to keep our city safe. Again, thank you so very much, and God bless, and God bless you and your family as well.
Thank you, Mayor Adams. Councilmember Wafo, did you want to make any closing remarks?
Yeah, Una, thanks to everybody who joined the calls today, and especially to our folks for the Q&A session and our briefing session. I do want to just take 1 minute while we do still have folks here to acknowledge our state delegates who are here and just give them a moment to provide some closing remarks as well. If Delegate Valentino Smith, Delegate Watson, or Delegate Holmes want to make just a few moments of remarks, I think that would be appropriate.
Thank you. This is Delegate Holmes, and I only want to say very, very briefly that this was a very, very important opportunity for us to get together and express our concerns. And as we all could hear, we are all working diligently together. Thank you very much.
Thank you, Adrian. This is Delegate Ron Watson. Just want to thank you for putting this together. You know, these calls are happening all around the county and all around the state, and it's so vital that we all stick together, come together to make sure we're playing from the same playbook and getting all the same information. So again, I thank you and the mayor for putting this together, and also thank Congressman Steny Hoyer. Thanks a lot.
Delegate Valentino Smith. Okay, we may have lost her. Are you there, Geraldine?
Can you hear me?
Yes, we can.
Hi, it's Delegate Valentino Smith. Just wanted to echo the comments of my colleagues and thanking the congressman, the mayor, the city council, and all of us being on. For the citizens of Bowie, we are working together, and together we'll get through this and continue to reach out. We're here to help you. We're here to work together, and we're here to make sure in the end, everybody survives. Thank you.
Okay, everyone, thank you very much for participating, for sending us your questions, for listening. We had some technical hiccups. I promise we'll do better next time, but keep the questions coming, and please use all the resources that were shared this evening. They really will help you. Thank you very much, and be safe. Good night.